We are now joined by Dr. Yanzhong Huang, who is Director of the Center for Global Health Studies at Seton Hall University. Good to see you, Doctor.
Good to see you too, Steve.
Doctor, one of your many areas of expertise involves China. More specifically, you've been talking a lot about, and it's important for us to better understand China's COVID policy. As we go into 2023, this show will be seen then. What exactly is that policy and what impact has it had on China's population?
Well, we're seeing a sea change in China's COVID response now, because until very recently, I mean, last month, they were still sticking to the so-called zero COVID policy. Basically, they could not tolerate any COVID infections. So even like a single case found in the locality could immediately trigger mass PCR testing, the close contact tracing, quarantine, and even snap lockdowns. But now we're seeing the policy is switched to another extreme. Basically, people are told you are on your own, right? So now they focused on preventing severe cases. Right? Many of these measures were simply dropped, like mandatory PCR testing, the checking of health codes before accessing public venues, the home quarantine for close contacts. Essentially, many of those measures were dropped. And now we're seeing a significant increase of the infections, but in Beijing and other parts of China. So the forecast is that in the first 6 months, or in the coming 6 months, we're going to see 60% of the population. We talk about about 850 million people. But that's more than twice of the U.S. population will be infected in the coming half a year.
Doctor, let me do this. I want to follow up on that. First of all, I want to make it clear, Seton Hall University, one of our higher ed partners. I want to follow up in this way. What is the significance, Dr. Huang, from your perspective, in understanding not only where China is, but what you believe and many other experts believe will be happening in China? What is the significance for the United States and the eastern region of the United States? Dr. Huang, please.
Well, I think it is worth taking a close eye on what is happening in China, because we know, right, this virus does not respect territorial borders. While in this country we have, right, according to a recent Harvard study, more than 90% of the population have been exposed, actually have been infected with the virus, but this virus can mutate. So according to some epidemiologists, in the coming months, we're going to see that a large number of immunocompromised people, those essentially who are not exposed to the virus in China, they could harbor the virus for months. So one leading epidemiologist basically said we're going to witness 1 billion or more opportunities for the virus to evolve. So that new variants could potentially, again, return to the United States and infecting more people, if you will.
But Dr. Huang, let me ask you this. The CDC, the Centers for Disease Control, clearly very important in dealing with this pandemic and other public health issues, has had its own approach to dealing with COVID. The most significant difference between the CDC approach versus the approach of the Chinese government is what?
Well, I think if we were talking about this before December, right, there's a big difference that here
on December 7th, the policies changed in China. But up to that point, it was dramatically different, correct?
Absolutely, right. The U.S. would rely on essentially vaccines, right, to prevent and control right, the disease outbreaks. But in China, they relied on non-pharmaceutical intervention measures like snap lockdowns, close contact tracing, quarantine.
So I'm sorry for interrupting, Doctor, but vaccines were not distributed and accepted widely in China, correct?
Well, it's not. exactly the case. In fact, according to the government data, they have more than 90% of the population receiving at least 2 doses of the vaccines. But I'm talking about the inactivated vaccines, not the mRNA vaccines many people receive here. But it is interesting that if you look at the certain segment of the population, like the elderly, especially those aged 80 and over, right, the vaccination rate is much lower, right? We're talking about essentially 8 million people aged 80 and over have not received any vaccine, and only about 40% of them received a booster shot.
Let me ask you this before I let you go, Doctor. Your book is called Toxic Politics. Why that title?
It is about China's environmental health. So we know, right, that one of the major contributors, right, to the China's environmental health crisis is PM 2.5, the small particles, right, that are actually considered very dangerous to people's health. So in that sense, it's toxic, right? But also, I want to examine the issues from the political perspective in terms of how China handles its environmental health crises. And we found that politics itself, right, in a way, can be toxic.
Yeah, and P.S., the United States and China are the biggest emitters of, put this in perspective, greenhouse gas?
Yeah, well, actually, the 2 countries, they are the largest emitters of greenhouse gases and they're the largest contributors, right, to global warming.
Yeah. So, Dr. Huang, I want to thank you for joining us. Dr. Huang is the director of the Center for Global Health Studies at Seton Hall University, a higher ed partner of ours. Thank you, Dr. Huang. Wish you all the best.
Thank you, Steve.
You got it. I'm Steve Adubato. That's Dr. Huang. See you next time.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Education Association, Valley Bank, Summit Health, Robert Wood Johnson Foundation, Atlantic Health System, Johnson & Johnson, the Northward Center, and by the New Jersey Economic Development Authority. Promotional support provided by New Jersey Globe and by bestofnj.com.
I'm Tim Sullivan, CEO of the New Jersey Economic Development Authority. Since joining the NJEDA, I've been struck by the incredible assets and resources that New Jersey has to offer. The NJEDA is working every day to grow New Jersey's economy in a way that maximizes the values of those assets to benefit every single New Jersey resident. This includes more support for small businesses and a focus on reclaiming New Jersey's position as a leader in the innovation economy. Visit njeda.com to learn more about how NJEDA is building a stronger and fairer New Jersey economy.